Nick Coorough, general surgeon. My specialty is general surgery, and I chose it because surgery has always felt like a calling for me and always been what interested me more than anything else in medicine. In general, allows me to do a lot of different things to help a lot of different people. We're kind of thought of as the jack of many traits in the medical community, and I like offering those services to people. It's something that I always thought would be a fun job when I was younger. The thing that sort of tipped the scales in that direction was when I was in high school. My dad started having bad chest pains with even the slightest bit of walking, couldn't go upstairs or anything like that. Went to the hospital, and long story short, a surgeon who we actually knew from our church came into the room, and as soon as we saw him, we said, uh-oh. It was bad news. He had some pretty bad blockages and he needed heart bypass surgery. At the time, I was young, I didn't exactly know what was going on, but all I knew is that after surgery, 6 weeks later, he was running around the yard with me. And I thought, boy, if I could do that for other kids' dads, that would be quite the job. I like to take an individual approach to patients. Luckily, in my practice, I don't feel overly rushed when I'm with a person, so I like to take time to get to know them and see what's important to them, what their values are. My philosophy is do what's best for the patient. I'm not here to say, I'm doing what's best for Bellin or the place that employs me. Luckily, Bellin is a place that allows me to treat the patient and give them the best surgery possible, and they expect a good quality in that process. Robotic surgery has really been a nice tool in the general surgeon's arsenal. It started out primarily with our obstetrician, gynecology colleagues, and the urologists using it. Over time, the general surgeons have found there's a lot of really great ways it can help us out. A typical first appointment is you and I meeting and talking face to face. Before you get there, I'll have reviewed your chart. I know as much as I can know about why you're here, but I'll still ask you why you're here and what your understanding is of what's going on, because sometimes the way doctors communicate with each other is different than what you understand your prior provider had told you. So we get to know each other. I ask you about what's going on and concerning you, but I also try to get to know a little bit about your lifestyle, what's important to you, what type of employment you have if you're working, because surgery puts the brakes on in people's lives. And if you're someone who has a job where you need to be active and lifting heavy things, sometimes we have to find a right time frame or the right kind of surgery for you that fits into your lifestyle.